Welcome again to my channel, everyone, or welcome back to my channel. This is your favorite nurse, Trev, and today we're going to continue with our lessons on diabetes. Now, those of you who were here yesterday, I went over the risk factors of diabetes. If you have not yet seen that video, you may go back and watch it. But I will also go over it again today as we move forward with the signs and symptoms of diabetes. Now, yesterday we talked about the risk factors. The risk factors of diabetes, we said, we're eating too much sweets. Now, if you eat too much sweets and you don't produce enough insulin to take care of those sweets, they stay floating around in your system, and that excess glucose causes damage to your organs. Next, we talk about hypertension. If you are predisposed to hypertension, you are predisposed to diabetes. If you have hypertension already, you are predisposed to diabetes. We also said hyperlipidemia, which is also called high cholesterol. If your cholesterol is high, that's a predisposition for diabetes. We also talked about familial tendencies. Those of you not familiar with those terms, it means that hereditary, meaning that your close family members, like a parent or a sibling, has hereditary diabetes. Not diabetes that they develop because of a pancreas injury, but an hereditary diagnosis. Then that predisposes you to becoming a diabetic. We also talked about infections. If you've had a viral infection that has affected your pancreas, that could predispose you as well. And also with age. As we get older, our body systems change, and so we get predisposed to diseases like diabetes. If you had an injury to your pancreas, that could also predispose you to diabetes, because then and there your pancreas won't be able to produce the insulin that your body needs to control your glucose levels. Today we're going to move into the signs and symptoms of diabetes. One of the first signs of diabetes is polydipsia. I wonder what kind of a term is that? Polydipsia means that you are thirsty a lot. You find yourself just drinking water, you're just thirsty a lot. That leads to polyuria, because the more you drink is the more you pee. So that's also a sign. And the next P is polyphagia, meaning you are hungry a lot. And we are going to talk about that later on, about why you get hungry a lot and why you get thirsty a lot. But if you hear somebody talk about the 3 P's of diabetes, that's what they're talking about. Polydipsia, polyphagia, and polyuria. Also, another sign and symptom of diabetes is gaining weight without trying. And you can also lose weight without trying. When you find yourselves with these symptoms, it is best for you to consult with your primary care provider right away. One of the first things they're going to do is check your urine. And you may ask, why they're checking my urine for sugar? Well, on a normal day, the urine does not have much sugar in it. But for people with diabetes who have too much sugar floating around in their system, the kidneys try to help. And when the kidneys try to help, they try to filter out some of that sugar into the urine. So when your provider tests your urine and he finds that there is increased sugar in your urine, that's a classic sign that you are going to get a diagnosis of diabetes. Also, you're going to find that you are going to become dry. Your skin is going to be dry. Your nails brittle. Your hair dry. Have you made the connection yet? If you are drinking a lot and you are still thirsty and you are peeing a lot, all that fluid is gone, leaving your skin, your nails, and your hair very dry. Also, you will get headaches. You will also become dehydrated, chapped lips, increased creases and wrinkles on your skin because there is not enough hydration. Also, you can have tinglings in the fingers and the toes. So now we know there are lots of signs and symptoms of diabetes. Now, check yourself daily to see if any of these signs and symptoms apply to you. And if they do, it is time to get with your doctor. It is not time to wait. And don't forget that when you go to see your primary care provider, always tell them the truth and tell them everything that is going on with you. It is never safe to keep information away from your provider because it is the information that you provide that helps your provider to create the best care plan for you. That's going to be it from your Nurse Trev today. Until next time, my friends, this is Trev from Trevessence, where your journey matters.